The World Health Organization has commended South Africa for its spirited fight against COVID-19. Speaking in Geneva, Switzerland today, the WHO officials updated progress made by their scientists and health experts sent to South Africa last month to assist.
The lessons learned and the knowledge exchange has been excellent, and in many ways South Africa reached out to WHO not through weakness but through strength, in recognising that it had a complex outbreak on its hands, and not that it needed the help of WHO, but what it wanted to do was be able to work with WHO to identify areas in which things could be done better. South Africa has a strong health system, very strong laboratory system, very proud history in diagnostics, and proud history in vaccination. So I think also a lot of some of the work has been looking at preparation for down the line, and how a country like South Africa again can prepare itself for potentially delivering a safe and effective vaccine.
From the figures we have, if you take the number of cases, as you know, the week of July 20 was when it had the highest peak, around 83,000, more than 83,000 cases per week. And now in August 24, the week of August 24, that's the last week, it's now 15,000 cases per week. This is a significant reduction. But not just the number of cases, the most important indicator is actually deaths. And the number of deaths, if we take when it reached its climax, the August 3, more than 2,000 a week. Now in August 24, it's actually 994, August 24. So South Africa is doing its best. We know it's very, very complicated, but it's doing its best, and we're very glad to partner and send our colleagues there to work with. And it's an honor for us to support any country. And with the current trend, we hope to further push it to a decline and further control the pandemic. But I would like to use this opportunity to thank the leadership of the President Ramaphosa, not only in South Africa, but in the whole continent, by helping to develop the continental strategy, one continental strategy, and helping the continent to move as one.
So just to give you an update on the situation, the Health Department saying as of Sunday, the last figures that have reported, cumulative total at 638,517 is what we stand at confirmed COVID-19 cases in South Africa, with 1,633 new cases identified. The total number of tests conducted to date, 3,800,190 rather, with 16,367 new tests conducted since the previous report. The department, in a statement released by the Health Minister, Dr. Salim Abdool Karim, regrettably reported 110 more COVID-19 related deaths. And to talk a little bit more about the situation here at home and what else we should be looking out for, head of government's Advisory Ministerial Committee on COVID-19, Professor Salim, a very good evening to you, and thank you so much for speaking to us. I want to talk about what Dr. Tedros Ghebreyesus said earlier on about one of the major indicators of COVID-19 is the deaths. Looking at South Africa, the number of deaths, I heard Professor Mahdi say earlier on that it's not really indicative of the number of deaths that we're seeing, that there could be as high as 35,000. You and I have discussed this. So where do we sit now? Do we believe that what we're reflecting is reality?
When we look at the deaths, good evening to Sapiso and all of the viewers, we are looking at just one end of the complete spectrum of disease. We have people who have no symptoms, mild symptoms, who are ill but do not need medical care, and then those who need oxygen and those who die. When we're looking at the extreme end of those who die, we have the reported cases, and there's about 14,000 of those. And then we can also look at the excess deaths. In other words, based on what we predict we should have had, we have more than that. And most of that occurred during our peak. And so if we add those excess deaths, we'll probably have about another 20,000 deaths or so. That translates into South Africa's deaths maybe twice as high or maybe even 2.5 times as high. At the moment, if we look at our current death rate, we are ranked around 117th in the world. So that means we have a death rate better than 116 other countries. If we multiply it by 2 or 2.5, we still are better off than about 50 or so other countries. So even if we take a worst case scenario, we actually have a death rate that's lower than expected. And this is partially because of our younger population and partially because we were able to better prepare. We had field hospitals, we had oxygen supply, we had dexamethasone. So there were many things that contributed to our lower than expected death rate.
And just the herd of infections, how does that influence that? That lower than expected death rate is exactly what is worrying some skeptics, might I say, on the figures that we're reporting. Admittedly, the health department has also issued an instruction saying that mortuaries themselves have now got to get involved in testing people to ensure that we collate the figures correctly.
Yeah, so the way in which to resolve any concern you might have about the numbers is to look at the complete 4 separate indicators. So you look at the number of cases, you look at the percentage of tests that are positive, and we are testing at the moment somewhere between 15 and about 25,000 cases, doing between 15,000 and 25,000 tests per day. And so the positivity rate, the proportion of tests that are positive, we also want to see that get below 10%, which is about where it is right now. And then we want to look at the admissions. And there we're seeing very clear trends in the admissions, and we're seeing a very clear trend in the deaths. So when you look at the totality of the evidence, it's all going in the same direction. So it's very unlikely that, it's a maverick or an odd finding or it's just all nonsense.
Okay.
In reality, that it all follows.
But we also had the WHO talk about the fact that it's encouraged, looking at the African region, that the number of cases, positive cases, are going down, but also warning that we should be careful. Now, it's recommended avoiding the 3 C's, the crowded places, close contact settings, confined and enclosed settings. Are we really doing that in level 2, though? Because there a great deal of concerns that are being raised, the fact that we have suddenly abandoned the precautionary safety measures.
When we looked at our situation, because we had gone into quite substantial restrictions early, that's not really sustainable. And so we had to release that, even at a time when cases are going up. Now we have a situation where cases have come down quite drastically, and we've eased the restrictions even more. The piece that really concerns me is that at 2,000 to 2,500 cases per day, we are still in the midst of an epidemic. When I look at people and they're becoming complacent and they are not following the rules of social distancing and mask wearing, they are going to lead to a situation where we could have another surge. We could get an increase in cases. So we have to appeal to people that we are still in the midst of an epidemic. And so we have to really follow the rules, because if we don't, the consequences could be dire.
And it's interesting, Professor Salim, to hear the WHO Director General talk about lockdowns as blunt instruments, saying that we need to get the right mix of targeted and tailored measures. At this point in our infection trajectory, given the fact that we are trying to resurge the economy at the same time while ensuring that people keep to the public health safety measures, what is the right combination for us? We've seen them praise us, but surely that's not enough. As you say, we are still in the midst of an epidemic, though the surge may be behind us.
So when we were dealing with this epidemic right at the beginning, in March, when we knew very little of, how it was spread and so on, there was a need for urgent and decisive government action. Because if we adopted the traditional public health measures route, it would just take us too long to get everybody, to convince everyone to start wearing masks and to social distance. So there was a need for urgent, decisive action, and we did that. But then we have to transition out of that, because we have to, I call it, you have to pivot the prevention paradigm. And I presented this at the International COVID-19 conference, that you need to move from a situation where you depended on government action to a position where you depend on individual action. But that individual action needs to consider that I will never be safe unless everyone is safe. So I am safe because you are safe. And that belief system will enable us to protect everybody. Because if we don't take that approach, then we will have individuals that will have a don't care attitude, and that might pose a problem. And I think so far we've done reasonably well. There are pockets where we're not doing as well. But overall, the reason our epidemic came down as rapidly as it did, it's because we had enough people adopting the various prevention measures. Because if we didn't, we would still be in the midst of 10,000 cases per day.
I want to talk about this, that the WHO spoke about the warnings about the use of corticosteroids to treat patients with severe COVID-19. So what are corticosteroids, and what exactly are we using for severely and critically ill patients?
So there was a study in Britain at Oxford University that showed that using this drug called dexamethasone was able to suppress the immune response that leads to the really bad outcomes and the deaths in COVID-19. In fact, it reduced deaths by about a third. And so now we are using combinations of steroids in order to suppress the immune response, but you've got to use it at the right time. If you use it in patients before they require oxygen, it has the opposite effect. So you have to use it at the right time, and when used judiciously, it can be a very important drug in our arsenal in terms of reducing mortality. But you have to choose the right drugs at the right dose at the right time. And I think that's the caution that you're hearing.
And the WHO was speaking recently about being careful of the local context, especially in these vaccine candidate trials. Now, we are undertaking our own, but let's talk about what we could be doing just in terms of the vaccine development and also supply. That is something that is limited. What are we looking at the moment? Because I think there's a great need to ensure that we stem this before more deaths are recorded.
Yeah, when you take South Africa, we have a very rich history of doing excellent work, for example, on HIV vaccines. In the field of coronaviruses, we actually have capacity in this country to make vaccines against coronaviruses, but they are made usually for animals. And there are individuals, there are scientists in South Africa that have made coronavirus vaccines and actually have made other vaccines. For example, in the poultry industry, there's a whole history of vaccinologists being able to make these vaccines. I was disappointed that we didn't put enough effort, and I take part of that blame. We didn't push strongly enough for South Africa to actually take some kind of leadership role in developing a vaccine and to use that capacity we had to make a local vaccine. Partly it happened because we came late into the epidemic. There were already several candidates out there, but we should have done that nevertheless. So now we are dependent on other countries and drug companies that are making vaccines. And now we have to make a contribution, and we've offered ourselves, and we're involved already in doing vaccine trials and testing vaccines made elsewhere. And that's important because that's how, as a global effort, we'll be able to discover whether a vaccine works or not.
As always, thank you so much. It's a pleasure. Professor Salim Abdool Karim, head of the COVID-19 Ministerial Advisory Committee, thank you very much. We're going to take a quick break. We'll return shortly, talk about the DA policy conference and its outcomes, and we're also taking your thoughts on the Clicks incidents, as it's been called. Various stores, some have been trashed by protesters, EFF leading the march against what it says is racism. Are the right people being held accountable is the question we're asking. Do stay with us.
For over 84 years, the SABC has been at the forefront of broadcast radio and television, bringing joy and happiness to the homes of many while continually redefining South Africa's media landscape.